Hello, I'm Dr. Dennis McKenna. Today, I bring you an update about our negotiations with the New York State Nurses Association, which have reached a new and critical stage. I last addressed you on October 3rd, nearly 9 weeks ago. I shared that we had presented significant increases in pay and benefits that you have earned and deserve. I told you of our commitment to ensuring these increases were implemented immediately. Unfortunately, NYSNA has not allowed this proposal to move forward for a vote. As a result, 4 pay periods have passed, and you have not received the market adjustments you deserve. The reason is straightforward. During these negotiations, NYSNA has insisted that Albany Med become a closed union shop, requiring every nurse in the bargaining unit to pay dues to NYSNA as a condition of employment at Albany Med. I've always maintained that this decision should remain yours. Whether or not to pay union dues should be your choice. That is why today, Albany Med is an open shop. This principle is at the heart of NYSNA's delaying in finalizing your market adjustments. NYSNA wants the money in their pocket. I want it in yours. In total, we have been negotiating for over 30 weeks, more than 7 months, advocating for a contract that includes significant pay increases and enhanced benefits, many of which your colleagues and coworkers here at Albany Med are already receiving, in some cases for over a year. Let me remind you of some of the key components of our proposal. Significant base hourly wage increases. Higher starting pay for newly licensed nurses. Reinstatement of premium pay. Introduction of preceptor pay. Increase to charge pay. Increased tuition reimbursement and support for continuing education and advanced certifications. Our proposal also has significant improvements to staffing. This work began in July when we reached a unanimous agreement on the 2025 staffing plan with the Clinical Staffing Committee. And we have had an open and fair peer election for those that will serve on the Staffing Committee in 2025. We hear you, and we agree with all of you to have more nurses at the bedside. We have launched numerous programs with local nursing schools to achieve this goal. Together, we have had great success with more recruits, including many who traveled these last few years and are now coming back home. We also have had far less turnover, with the results in 2024 being measurable improvements in both recruitment and retention. And I'm proud to tell you that we have already begun to recruit these additional nurses so that we can achieve those staffing levels in 2025. This summary does not cover everything that we have put on the table. It is a proposal that reflects our recognition of your hard work, commitment, and the compassionate care you provide every day. I began the video saying that these negotiations with NYSNA have entered what I refer to as a new and critical stage. Let me explain. Today, we presented NYSNA with what we are calling our last, best, and final offer. This decision wasn't made lightly, but I firmly believe after 7 months, it is time to move forward together. This contract gives you immediate and substantial benefits. It ensures higher pay during the holidays, and as we enter 2025, it positions Albany Med as a leader in nursing compensation and recruitment. This new contract would accelerate our recent success in recruiting new nurses to join our team. You want that, and so do I. There is one thing that we have added to this proposal, which is new. We have not offered it before today. With this last, best, and final offer, we would also provide retro pay for base salary to the first full pay following August 1, 2024. The reason why I am willing to add this now is because we truly want this contract finalized. It is time. But this proposal is not only our last, best, and final, it must also be time limited. We are in active negotiations with a local payer that is seeking to significantly reduce their payments to us, creating financial uncertainty for 2025. Yet despite this challenge, we have still made a strong and favorable offer to NYSNA that directly benefits you, our nurses. However, because the outcome of these payer negotiations impacts our financial flexibility and budget process, this offer must be time-limited. Acting now ensures we can move forward together with clarity and stability. The bottom line, we will need to have this proposal accepted in 1 week or by December 9th. Otherwise, this offer of retro pay will come off the table. In order to plan for 2025, we must get it done now, and I sincerely hope we do. I recognize there's often hope in negotiations that holding out longer will lead to more. But I want to be clear. This offer reflects our financial realities as a not-for-profit organization. We must balance our priorities responsibly now more than ever. It is an offer that is fair. It is an offer that is equitable. And it is an offer that is our last, best, and final. This bears repeating. Albany Med is advocating for you. From the beginning, our proposals recognize your commitment to our patients and respect the compassionate, high-quality care that you provide. You have earned the proposals we put on the table. We have been more than ready to give them to you. But if NYSNA ultimately decides to reject the offer, these new proposals must and will come off the table on December 9th. I sincerely hope that NYSNA and their bargaining committee agree to our offer and leave it up to you, our nurses, to vote on this proposal. Our offer is an excellent one, but I cannot do this alone. Only you can organize yourselves to advocate for what you deserve. You must talk to the nurses who are meant to represent you at the negotiation table. If you want this adjustment, if you want this retro pay, you must tell them you want it and you want it now. I encourage you to reach out to your union representatives so we can get this done. Call for a vote. You earned it. You deserve it. We want to give it to you. Go get what is yours. In closing, settling this contract is about more than just resolving the details. It's about coming together. We are stronger when we stand united. This time of year reminds us to focus on our Albany Med family and how a unified workforce can achieve extraordinary things. By prioritizing what truly matters, supporting our staff and caring for those who rely on us, we can move forward together. Finalizing this contract will give us the foundation we need to heal, grow, and continue making a difference in our region. I hope you would agree.